Hi everyone. Today I'm going to be talking about deep vein thrombosis, or DVT. Right here you can see a diagram of a blood clot that has formed in a deep vein in your leg, which is what is known as deep vein thrombosis. So first, let's quickly go over what a blood clot is. A blood clot is a mesh net made from fibrin strands that traps the blood cells and platelets that form during hemostasis. Sometimes blood clots can cause blockages in your blood vessels, and these are known as emboluses or thrombosis. An embolus is when a blood clot causes a blockage in your artery, and a thrombus is when a blood clot causes a blockage in your veins. Right here you can see the steps of hemostasis, and you notice that a blood clot is right here, and it is formed in step 3 of hemostasis. So what causes deep vein thrombosis? Deep vein thrombosis occurs when a blood clot forms in a deep vein. A deep vein is a vein that's located deep in your body, farther away from the surface of your body, as opposed to a superficial vein, which is a vein located closer to the surface of your body. This commonly occurs in the veins of your legs. Some common risk factors for DVT are inheriting a blood clotting disorder. As you can imagine, if you have a blood clotting disorder, this would put you at a higher risk of developing DVT. A prolonged bed rest or sitting for long periods of time. This risk factor is one of the reasons why people that go on plane rides are more prone to develop DVT, since they're sitting for such long hours at a time. It can also result from injury or surgery, pregnancy, cancer, and family history. You can either inherit DVT directly or develop it from inheriting a blood clotting disorder, as I stated previously. Right here you can see a small diagram. You can see it starts with normal blood flow, then you see the embolus blocking the blood flow in a vein, and you see how it affects your blood flow. So there are many ways to diagnose DVT. One way is to use an ultrasound. An ultrasound works by using sound waves to penetrate tissue and create an image. People also use the ultrasound to check back for many times to see if the blood clot is shrinking or increasing in size. Another way to diagnose is by using a blood test. Doctors or people that develop DVT have an elevated D-dimer, which is a substance found in the blood after getting DVT. You can also use a venography. A venography is when dye gets injected into your veins, and the X-ray creates an image from that dye of that specific location. This is very useful to see locations of your clot. And you can also use a CT or an MRI scan. This is visual image. This creates a visual image to locate the specific locations of the clots in the image, or in the location of your body that is getting scanned by these machines. Some common symptoms of DVT are sudden shortness of breath, chest pain or discomfort, lightheadedness or dizziness, rapid pulse, and in extreme cases, coughing up blood. Right here you can see a quick diagram of how venography works. You can see the catheter that's inserting the contrast material into the vein. This contrast material is what helps the X-ray create a clear image of the vein and a clear image of clots that could be located in your vein. So there are treatments for DVT, the most common one being blood thinners. Blood thinners are used to decrease the body's ability to clot, which helps decrease your chances of developing DVT. The most common form of blood thinner is heparin, and this is often injected directly under the skin. However, in more severe cases, doctors will use clot busters, and this is usually injected through an IV or a catheter similar to the one we saw in the previous slide. And this catheter goes directly into the vein that is affected by DVT to clear out the clot that is causing blockage. If these don't work, for some reason, if a patient can't take the blood thinners, a filter is used. This filter is inserted into the vena cava of your abdomen, and this prevents clots from breaking loose and entering your lungs, which could result in a pulmonary embolism, which is something we want to avoid at all costs. And also, doctors will give patients compression stockings, and this is just used to prevent swelling that often is associated with DVT. The blood clots cause certain areas of your body to swell up, and these compression stockings help reduce the swelling in those areas. And here is just a picture of a vial of heparin. So more information. DVT can be both acute or chronic, and this depends on the response and the number of thrombosis during the anticoagulation therapy. It is known as an acute condition if the thrombus forms at the beginning of anticoagulation therapy and gets cleared up right away. However, it's considered a chronic condition if the thrombus persists throughout the therapy and more thrombus continue to pop up. Also, the way to develop DVT depends person to person. You can develop it after suffering a serious injury to a vein, which I mentioned earlier. It can also develop post surgery. During surgery, you could get a injury in your vein, which could cause blood clots and result in DVT. However, it can also be inherited via blood clotting disorder, like I went over. The most common blood clotting disorder being factor V Leiden. The good news is DVT can be prevented by lifestyle and diet. If you have regular exercise and lose weight and quit smoking, these are very effective ways to combat developing DVT. So here's some statistics about DVT. It affects, on average, 600,000 Americans each year and killing up to 100,000. And 10 to 30% of people die of DVT within the first month of diagnosis. You can see this is a pretty high death rate. About 1/3 of people that get DVT will have long-term complications, which come in the form of post-thrombotic syndrome. This usually entails swelling in the affected limbs. DVT often occurs most in people over the age of 50, and it is more common in women. As I stated earlier, pregnancy is a common risk factor for DVT, so this puts women at a higher chance of developing DVT. So some quick fun facts about it. Serena Williams has DVT. At 29, she had to undergo an emergency surgery for a pulmonary embolism. With this pulmonary embolism resulted from her DVT. Another celebrity that has DVT is Brian Vickers, who is a championship NASCAR driver, and he ignored his symptoms and denied the treatment until he was forced to receive treatment. So very opposite. He was quite the opposite of Serena Williams. This resulted in him being unable to race for 6 months because the doctors were forced to step in and treat his condition. Here are some references I used. Thank you for listening, and I hope my presentation helped you learn more about deep vein thrombosis.